With musical skills and experience, Dr. Jakrit Glapachon, head of Rehabilitation Department, and Dr. Lakana Taikgrua from the Community Medicine Department came up with the concept of using music to improve muscle strength, finger dexterity, and to reduce spasticity, and also thoroughly planned to include mental and social interventions as a holistic approach for the benefit of physically disabled children of Si Sangwan School. It was a big challenge at that time, since music therapy was very new in Thailand. Therefore, they established Music Therapy Group by inviting colleagues and volunteers, Janine George, a registered music therapist from the USA who worked at the College of Music, Payap University, joined the group and shared essential basics, which became a fundamental guideline for the current music therapy practice. Anurag Tantong, an instructor from the Department of Psychology, Chiang Mai University, also joined the music therapy group as a consultant. Dr. Jakrit was attracted by a musical notation system using color substitution technique. He created a music therapy program based on this technique and made some song arrangements for the students. Note charts were used to replace standard notes for those keyboard-playing students who could not read notes on a standard 5-line musical staff. The music therapy group applied each of 7 colors for each of the white keys in the middle octave of the keyboard instrument, and then a colored note chart was created using colored blocks substituting musical notes: pink, gray, red, yellow, green, blue, and orange for A, B, C, D, E, F, and G notes, respectively. The underlying reason for that specific color notation was according to Thai pronunciation of standard note names. For example, red color for do or dang in Thai, yellow color for re, luang in Thai. L and R are pronounced very similarly. Blue color for fa is fa in Thai. The music therapy group found that these colorful charts stimulated enthusiasm and liveliness during practice. Most of the songs were simplified and split into parts to be played in separate lines by each student. Physical and musical capabilities of the children would determine their participation level in the program. A boy with achondroplasia and subsequent short stature needed adjustment of the height of the seat and the drums to be lower than normal. The music therapy group divided the students into subgroups according to their physical and musical limitations and preferences on musical instruments. Those with problems of weak and spastic hands and fingers played percussion instruments or keyboards. Those with spasticity and/or poor lung capacity were chosen to play melodeons. A boy with spastic cerebral palsy was using his spastic but most capable middle finger to press a key. A boy with congenital arthrogryposis was showing his incredible skill in using his mouth, playing simultaneously 2 keys on the keyboard. The music teachers at Si Sangwan School were responsible for training eligible students under the supervision of the music therapy group. The music therapy group also did follow-up tests to assess the program and additional techniques were given from time to time. The students were assigned to play easy, therapeutic songs at the beginning and then songs of gradually increasing difficulty. Therapeutic musical notes were intended to improve the students' capabilities by means of musical instrument-based practices. For example, whole notes, semi-breve, were applied frequently in the pieces for melodeon players with a tempo of approximately 75 in order for students to play 3-second notes via exhalation, assuming that multiple sessions would promote their lung capacity. Other specific musical notes were also inserted and rearranged with the aims to improve finger dexterity and eye-hand coordination for the keyboard players and percussion players. It was a particularly difficult challenge for disabled students to play music instruments together in a band. However, they kept on practicing, helped each other, and learned how to work as a team. Amazingly, they could perform beautiful and magnificent pieces of music and impressed the audiences. During the first show of the band with the faculty dean, we included able-bodied dancers at the hospital on the 50th year anniversary of the Faculty in Medicine. This was in 2009. The music therapy group found that music is a marvelous tool for building learning capability, increasing self-esteem, improving muscle flexibility, increasing lung capacity, reducing muscle spasm, and improving muscle strength among the disabled children. In addition, the music therapy program could boost the self-esteem among the disabled children. Having joined the music therapy program as the players in the band, these disabled students felt more happy and joyful than they had when participating in the regular therapy program. Able-bodied people who had the chance to know them and see their fabulous performances were remarkably touched by their efforts and braveries, which led to a spiritual boost and improved self-perception for the audiences also. The students had a relaxing time in an amusement park after the show at the National Hospital Accreditation Conference in 2010. Because of the success of the program, the music therapy group energetically continues to provide useful information and create the guidelines of music rehabilitation for other healthcare services that take care of disabled people. In this way, the network is gradually established and sustained. The music therapy group received the Innovation Award on Mahidol Day in 2009. The music therapy group received Excellent Public Service Awards from Prime Minister Apisit Wechachivwa in 2010.
Chiang Mai University, Maharaj, Nakorn, Chiang Mai Hospital. Faculty of Medicine, Chiang Mai University.